Good morning, everyone, and thank you for joining us this morning for this Centering Equity and Safety webinar. My name is Gary Huttman. I'm the Executive Director of MetroPlan Orlando, and we're so glad to have you here for this third offering in our Vision Zero Safety Speaker Series. Today's event, we will look at two issues that are very important to our work as a transportation planning organization and how each of those are connected. At MetroPlan Orlando, our vision is for a transportation system that offers options for everyone in Central Florida to move safely around the region. At the same time, we know some areas are not as safe as they should be and that some people do not have the options that they need. So we're working to improve both of those things. We have done some detailed research in areas in Central Florida that we call transportation underserved communities. These are places where residents face more than their fair share of barriers that make transportation difficult for them. Currently, those communities account for about 38% of the roads in our region. Yet the same areas account for more than half of our traffic crashes, and again, more than half of our traffic deaths and serious injuries. If you get around by walking or perhaps riding a bicycle, you're also more likely to be killed or seriously injured traveling in an underserved community. So it's clear that in terms of traffic crashes, the residents of these communities are less safe than residents elsewhere in the region. When we began our work on Vision Zero Central Florida several months ago, we could see that there was work to do almost everywhere, but our analysis confirmed the distribution of that safety work was not spread out evenly. We analyzed crashes across the region and highlighted what we call high injury networks, where a disproportionate number of crashes result in death or serious injury. And sure enough, the high injury network affects communities classified by the federal government as disadvantaged much more frequently than other neighborhoods. At the same time, we have been updating our Title VI plan to make it into what we're calling a Transportation for All plan, to lay out ways we can make transportation accessible for everyone. In both these efforts, we are committed to safe transportation for all of Central Florida, and we're going to talk more about that this morning. Today's session begins with a presentation from Charles Brown. Charles is a leading expert in equitable transportation research. Following the presentation, we will have some time for questions. We'll be taking those through the Q&A tool that you see at the bottom of your Zoom screen, and you can write your questions and submit those at any time during the presentation. We're going to be asking for your participation throughout the webinar. When we get to the Q&A, Charles will be joined on screen by three MetroPlan Orlando staff members who are serving as project managers for Vision Zero Central Florida, so we can get national as well as regional perspectives. Then around 11 o'clock, I'm going to turn this over to Virginia Whittington. Virginia is MetroPlan Orlando's Director of Regional Partnerships, and she will take you through some more in-depth discussions about the information we have heard and the issues that we need to address in the future. We hope that you'll be able to stick around for those small group discussions and that you'll share your experiences and opinions with us. Now it's my pleasure to present today's keynote speaker, Charles Brown. Charles is the founder and principal of Equitable Cities, an urban planning, public policy, and research firm that's focused on transportation, health, and equity. He is also an adjunct professor at the School of Planning and Public Policy at Rutgers University. He is an award-winning expert in planning and policy and has authored several groundbreaking studies on the role of race and racism in transportation and mobility. In addition to his work all over the world, Charles has strong connections right here in Central Florida. He received his Master of Public Administration degree and his graduate certificate in urban and regional planning from the University of Central Florida. He was also awarded the Alumni Achievement Award for Public Administration in 2020. Among his previous employers is the City of Orlando, and Charles even served on the MetroPlan Orlando's former Bicycle and Pedestrian Advisory Committee back in 2008, 2009. So please welcome Charles for his presentation.
Thank you. Thank you so much, Gary, for that wonderful introduction. Please allow me a moment to set up slide share for everyone. All right, again, good morning, everyone. My name is Charles T. Brown. It is an absolute honor to be here with you today. Special thanks to you, Gary, the team at MetroPlan, Orlando, and Kittleson for having me here. Today, I would like to discuss safety and equity matters, the importance of centering equity and safety in regional Vision Zero efforts. Today, what we'll do is explore the critical intersections of safety and equity in transportation planning with a particular focus on Vision Zero, which each of you know by now is a global movement aimed at eliminating all traffic fatalities and severe injuries while increasing safe, healthy, and equitable mobility for all. In our session today, I'll emphasize the necessity of visionary, bold, brave, and competent leadership in achieving these ambitious goals. Doing so, I'll draw from cities I've worked with throughout the US, which have made remarkable strides in reducing traffic fatalities to zero. And in doing so, we'll examine the principles and practices that can guide us in creating safer and more equitable transportation systems for all. I'll introduce to you an equity framework that I've been using for a number of years now that includes everything from recognition justice down to restorative justice. This framework will serve as the foundation for my presentation today. And this comprehensive framework, which I hope you take back with you, ensures that we address not only the immediate safety needs, but also the underlying social and historical context that contribute to disparities in transportation outcome. So together, what we'll do is delve into strategies that prioritize the safety and well-being of all community members. And I want to again emphasize all, but especially though those from historically underserved and marginalized groups. So thank you for joining us in this important conversation today. Let's move forward with this shared commitment. I prefer to move forward firstly with introducing to you to me as a young man, or me to you as a young man. This picture here is a reminder of the really shy kid I used to be and still am to a certain extent. But what he identifies today is as a street level researcher and a academic. And I identify as both a street level research and a academic, given my 2+ decades years of experience of working both inside and outside of academia for many, many years now. If you didn't know, I'm from a very small town in rural Mississippi. It's in between Starkville and Meridian, and that town is Shaquela or Sugarlock, Mississippi. And it has approximately 350 to 400 people there. So I understand the rural context, I understand the urban context, as well as the suburban context, because I've been very fortunate to not only travel many places around the world, but also work with communities of all sizes, ideologies, and cultures. And some of them are blue politically, some of them are red, some of them are green, and unfortunately, some of them are also quite confused. So, in short, I have 99 problems, but understanding you will not be one of them. I also live by the African proverb, I am because we are. And as was stated, let's not forget Orlando is also my home. I spent 6 years there, which was some of the best years of my life. I got married while I was there to my beautiful bride, Latasca. I had my first son, Christian. I became a member of the greatest fraternity known to mankind, Kappa Alpha Psi Fraternity Incorporated. I worked with some of my favorite colleagues ever at the city of Orlando. I saw Gus Castro was here. He and many others are some people that I still miss to this day. And I became a two-time graduate of the University of Central Florida. And as was stated, I've sat in many a meetings at MetroPlan as a rep for the city. So Orlando will always have a special place in my heart, which is why I'm really honored to be here with you today. Now on to the presentation. What is equity? A lot of discussions about equity. Equity refers to the fair distribution of resources and opportunities, regardless of race, ethnicity, gender, or other characteristics. When we look at equity, the goal of equity is to ensure that everyone, not just some, but everyone has an equal chance to succeed. When we look at equity further, what we understand is that equity involves trying to understand and give people what they need to enjoy full, healthy lives. It is the presence of justice and fairness within the procedures, the processes, and the distribution of resources by institutions or systems. But equity doesn't end there, which is why we're here today talking about it in the context of Vision Zero. See, facing equity issues requires an understanding of the underlying or root causes of inequalities and oppression within our society. And when we look at the data, the crash statistics, et cetera, particularly through a demographic lens, what we find is that we really need to emphasize not just equity, but also racial equity within our work. And see, racial equity is about transforming the behaviors, the institutions, and the systems that disproportionately harm people of color and also all people. It's about increasing access to the power, it's about redistributing and providing additional resources, and ultimately eliminating barriers to opportunity in order to empower low income communities and communities of color to thrive and reach their full potential. There's been a lot of conversation about what equity is and what it isn't, but in the context of racial equity and equity as a whole, it is not about excluding other marginalized groups, as equity impacts intersect and compound with other identities such as gender, sexual orientation, ability, and etc. So a lot of the work or the things that we're challenged by in terms of implementing equity in our decision making is much more about the unseen than the seen. And to illustrate this best, I want to welcome you into my classroom here, as I do with students at Rutgers University when I have an opportunity to teach there. I show them this picture of the West Ward of Newark, New Jersey, a community that's predominantly people of color, low income, that I've enjoyed working with for many, many years. I asked these up and coming planners, engineers, and some architects and landscape architects, looking at this picture, what changes might you make, knowing the context in which it's been presented to you, being a historically underserved community? And many of the students say exactly what you're thinking right now. Well, I'll repair the sidewalk. I'll deal with the vacant properties. What about pedestrian scale lighting? Lighting is so important, by the way. What about the trees and the greenery, or wayfinding and benches and repaving and bike lanes? See, all of those things are important. But when we engaged the community, they too said those things, but not before they said, make sure you include us. See, it's not that people just think that bike lanes are white lanes. The issue with the bike lanes, the improvements, et cetera, is that as planners, as engineers, as landscape architects, we go from this to this. And if we do not include the people who are currently living there, they're not against the project. They're against the idea that you don't see them in the future when those changes come. And there's a reason for this. And it is because historically, transportation and planning have been weaponized, many feel, as a tool of oppression within our society. And that's true whether we look at the highway robbery that has happened in the historic Tremé in New Orleans, I-4 in Orlando, or many interstate highways across this system, across this country that have been, strategically deployed to unfortunately destroy many Black and brown and low income populations. We also know there is a connection between transportation decision making and how it impacts our climate. I was both fortunate and unfortunate to have survived Hurricane Katrina back in Mississippi in 2005 and Hurricane Sandy that hit New Jersey in 2012. And if some of you are wondering by now, no, hurricanes do not follow me. But I bring this up because climate and transportation decisions are deeply interconnected. Transportation is a significant source of greenhouse gas emissions, and it contributes much to climate change. But as we look further at these decisions, both good, bad, and indifferent, we also see, looking in 2019 at this Dangerous by Design report by Smart Growth America, that those most at risk includes older adults, people of color, and people walking in low-income communities. As it relates to older adults, the relative pedestrian danger for older adults aged 50 and above was more than a third higher than the general population. And I want to remind you, this is from 2019. And the reason why I say that is because this is going to be relevant as we move throughout the presentation. When we look at people of color between 2008 and 2017, Black and African Americans were 72% more likely to have been killed or struck by drivers while walking. And whether one identifies as an older American or a person of color within America, we all find ourselves, particularly in the Orlando region, walking in or traversing through low income neighborhoods. And what we know from that time in that study is that people living in neighborhoods where the median household income is $36,000 or less were killed at much higher rate than their counterparts. And when I traveled around the country with Smart Growth America and many others advocating for complete streets, Vision Zero, et cetera, oftentimes some of the pushback we would get is that, hey, the infrastructure is fine. This is a behavioral issue. In fact, one person was quoted as saying, it's behavior, it's behavioral. It's all about the choices that we make. Now, there's some truth to that, but that's not the full truth. See, when we look at the equity implications, we cannot ignore the reality that to a degree, race or ethnicity does determine place, which ultimately, in the context of Vision Zero and safety, determines health. To best illustrate this, I take you to Peoria, Illinois, a place where I've been fortunate to work for some time. In this map, you see blue represents where the majority of whites live in Peoria, Illinois. Green represents where Black and African Americans live. Purple represents where Hispanic and our Asian brothers and sisters are represented by the other colors. And so in looking at this map, we see that someone who lives in a white neighborhood in Peoria will almost never go to a Black neighborhood. And a lot of people in Black neighborhoods won't get the opportunity to go to an affluent neighborhood. Now, Peoria was ranked as the #1 most racially segregated school system in the country. It was also ranked #6 in terms of the most racially segregated housing in this country. But this isn't just about Peoria. I show this not to be episodic, but to be thematic, which is why we must go to Detroit, Michigan. And if blue represents where the majority of whites live, green represents where Black live, purple Hispanics, what do you see in Detroit? Well, what you see in Detroit, unfortunately, is what you'll see in Houston, Texas. It's also what you will see in Atlanta, Georgia. And unfortunately, it's what you will see in the nation's capital in Washington, D.C. What you're seeing is racial residential segregation. And unfortunately, it's by design. And there are many policies and practices we could look to that see or back up this fact. And people start to ask, well, are there exceptions to the rule? So they bring up a place like New York City, which is on paper one of the more progressive cities in the country, but is still segregated by race. And so they ask further for an explanation. Are there places then that do not deal with this issue? And I just simply point them to Portland and say, sure, you go to Portland, you don't see any people of color. Now, that's a joke, but there's also a fact behind that. For a very long time, Portland, or the state of Oregon, which is one of the least diverse states in this country, outlawed Black and brown people from moving to the state. And so what we find then is that history doesn't say goodbye. History, unfortunately, says see you later. See, the data that I shared from the Dangerous by Design report earlier was back in 2019 with data from 2017. When we look at some of the more recent data, guess what it says? Basically, nothing has changed. The same people who are being disproportionately injured and killed on our roadways at that time are still being disproportionately injured and killed on our roadways today. They include Black, brown, low income, and people who I owe are older adults. And so that report, each time it comes out, in a way re-traumatizes me, not for the simple fact that I love all people and don't want anyone to get killed on our roadways, but it also has an origin story in Orlando. I can recall working for the city of Orlando back in 2011 when the report came out and the shockwaves that it sent throughout the area, mainly because we knew inside we were doing everything that we could to protect all citizens on the roadway. Now, everything that we were doing and everyone else in the metro area was doing, unfortunately, was not enough. Those reports continued to come out year after year after year. And what we know up until this point is that, guess what? Nothing has really changed. Unfortunately, the metro area as a whole still ranks high in terms of the most dangerous places for pedestrians in the country. Now, this saddens me because I know the great work that is being done inside Metro Plan Orlando, at the city of Orlando, and many of the surrounding areas, but it's still not addressing the issue. And when we look at the Metro Orlando Plan region, the Metro Plan Orlando region in particular, as was stated, we know when we look at crash deaths and serious injuries, 55% of all fatal and serious injury crashes in the region occurred in these transportation underserved communities. And if you're looking for a comparison on that, while 55 of the fatal and serious injuries happen, these communities only account for 38% of road centerline miles in the region. When we look at all the crashes, 52% of all the crashes in the region also occurred in these transportation underserved communities, which is disproportionately overrepresenting the TCU's share of roadway centerline miles. When we move into active transportation, more specifically biking and walking, 57% of all the crashes and serious injuries involving a pedestrian or a cyclist in that region occurred in these TUCs. Again, disproportionately overrepresenting the TCU's share of roadway center miles. And then lastly, as it relates to the high injury network, at 62%, the proportion of the high injury network in these areas is again higher than their share when compared to the region's corresponding roadway centerline miles. And then lastly, crashes involving people outside of a vehicle. We see that pedestrians, bicyclists, and motorists, as it relates to active transportation, motorcyclists, they account for about 3% of overall crashes, but 25% of serious injury crashes and 48% of fatal crashes in the region. We simply cannot have this. And this is also important in the context of not just active transportation, but also when we look at vital connections to public transit or those using public transit, as about half of links boarding and alightings take place on this high injury network. And so as we create a transportation plan for all, we cannot overlook these realities. And so then the question becomes, for me and for all of us, is how can we work together to create a safe, equitable, and inclusive system for all? I'm here to state that it really demands a reprogramming. And what I mean by a reprogramming is that many people admittedly feel that a lot of this is due to the risk behavior of pedestrians, cyclists, and motorcyclists, as was stated by the engineer in the quote that I listed. And if you believe this, then what you believe is that it ultimately leads to disease and injury, and ultimately, unfortunately, mortality. But that's only a portion of the truth. The real truth is that we have to go further upstream as they do in public health. And what we have to understand is that there exists a socio reality that favors some and unfavors others. And that leads to social inequities by class, by race, by ethnicity, by immigration status, by gender, sexual orientation, etc. Now, this social inequities has a bidirectional relationship with the institutional inequities that exist. And together, these create the living conditions through these transportation decision-making processes that ultimately influence behavior by pedestrians, cyclists, and others, leading to disease, injury, or mortality. So the real truth isn't that it's just about one's behavior. The truth is that the environment influences one's behavior. So if you come across a pedestrian or cyclist or motorist and they say, hey, the environment made me do it, in many ways, there's some truth to that. So where do we start? Where do we start? Well, we need a justice framework to deal with injustices. We need an equity framework to address inequities. And the justice framework that I'm here to cover now is one of recognition justice, distributive justice, procedural justice, interactional justice, representational justice, restorative justice, and care. Now, what is this justice framework and why it's important? Let's start with recognition justice. It forces us all to ask the question, have we considered the damage inflicted by a lack of recognition and misrecognition in our work? See, what recognition justice does is argues for the existence rights of different cultural and social groups with respect given to these differences in the face of transportation injustices. See, it considers the damage inflicted by both this lack of recognition and this misrecognition of these social groups within the discourse of transportation equity and justice. That takes us to next, distributive justice. See, it is concerned with the fair allocation of resources among diverse members of the community. And in the context of distributive justice, it forces us to ask the question, who has physical access to that street, to that park, or that trail? That becomes increasingly important as we look at safe routes to school. As my work has shown that here in New Jersey, when I did a study of Black and Brown residents, most respondents, 54% of them stated they do not feel that their children are safe from traffic when bicycling in their community. So yes, we want to encourage more children to bike and walk to school, but please know that in the Black and Brown communities, if moms say you're not biking because it's unsafe, more than likely you're not biking. But then there's the proximity to parks. And the study showed, and the study will show across the country that yes, many Black, Brown, and low income communities can safely bike and walk to their local parks and trails. Many say this based upon proximity mapping. Well, the reality is that proximity is not access. There exists a social political environment, whether it's harassment, whether it's assault, whether it's a number of factors that are preventing people, even when they're proximate, from walking to or biking to these parks and trails from their home. And it's a reality, it's an underpinning that we must address if we're going to create a transportation system that is safe and equitable for all, which takes us to the need for more procedural justice. See, procedural justice speaks to this idea of fair processes and how people's perceptions of fairness is strongly impacted by the quality of their experiences and not only the end result of these experiences. It forces us to think, who has influence over the design, the operations, and the programming? I cannot tell you how important it was for me to be a representative of the city of Orlando sitting in those Metro Plan meetings with my unique perspective and it being welcomed and it being rewarded and it mattering to the people that were making the decisions. And this is important because I know through mentorship that many minority youth are not included in planning and transportation decision-making processes, as well as many of my Black and Brown colleagues, unfortunately. And this is important because these are the very groups that ultimately will find themselves, unfortunately, victims of traffic injuries and fatalities, traffic crashes that lead to injuries and fatalities, which takes us to interactional justice. So what makes people feel welcomed or unwanted in a space? See, it's not just about designing a space and then leaving. We have to ensure through interactional justice, we have to consider the degree to which people affected by the decisions are also treated with dignity and respect. You'll see later on, one of my recommendations is around interagency coordination. This is important because there's the reality that African Americans are 2.5 times more likely to be killed by law enforcement, and Black males reported being stopped at a rate 7 times than that of females. So we don't want to just create the most pristine environment if people cannot enjoy it in an equitable fashion, which then takes us to representational justice. Do people, as we build out our systems, feel that their experiences and their history is represented in a space? Why is this important? Because as planners, engineers, architects, etc., we all have a responsibility to elevate voices historically oppressed by privilege. Unapologetically, we do. And so our vision of representational justice understands that representation matters and that we all possess the agency to manifest these narratives that embody humanity, truth, and respect, which is why I'm doing this work. And so this becomes increasingly important in this particular context because cultural erasure happens as we build out our systems, as we advocate for Vision Zero without equity as a lens, as a value, and as a virtue. Because historical and cultural erasure takes place in communities all across the country, and more specifically in the Orlando metro region, which takes us to restorative justice and the need for that. So as planners, engineers, et cetera, we must ask the question from a restorative justice standpoint, to what degree have we rectified injustices arising from these decisions? As restorative justice within transportation focuses on the needs of the victims. It focuses on those who have been harmed by roadways which have destroyed their entire community, as in the case of Duluth, Minnesota. And what we need then is to hear from the community as part of these processes, whether it's Vision Zero, whether it's safety efforts or equity, to ensure that their voice creates a system that better reconnects their environment overall. And so then that takes us lastly to care. How do people demonstrate their care for the space and other people in it? This becomes important because we just can't build it, we also have to maintain it. And in the maintenance of that, we must ensure that it continues to not be biased against women and the religious minority within our community. That's what it means to create a transportation system for all. It means that because in order to create a transportation system for all must be welcome as they are. So you may be wondering at this point, well, what should be done now? That's usually the big question. But what I'm doing is putting in practice the importance of looking at the historical context that created the realities of today. And so for now, what we should do are the following. Action number one, we should develop and implement a regional racial equity action plan that explicitly addresses the unique challenges faced by racial and ethnic minority communities within the Orlando region. This plan should include goals, strategies, and performance measures for reducing disparities in transportation safety, access, and outcomes. I know this is possible because I've worked with the largest metropolitan agency in the country, SCAG, better known as, of course, the Southern California Associations of Government. So they adopted a resolution affirming their commitment to advancing justice, equity, diversity, and inclusion throughout Southern California. And if SCAG can create and center the importance of racial equity within our work, I know we can do too in the Orlando metro region, which takes us to action number two, the importance of prioritizing safety investments in transportation underserved communities. So given that 55% of fatal and serious injuries crashes and 57% of serious pedestrian and bicycle crashes occur in these transportation underserved communities, it is crucial. It is vital to allocate a significant portion of safety investments to these areas. This could include infrastructure improvements like better lighting, which is seriously important, pedestrian crossings, protected bike lanes, and traffic calming measures. But we need the resources to move towards the greater need. And when you look at the greater need in your region, these 10 zip codes represent 20% of the Metro Orlando population, but 30% of the non-motorist KSI crashes. So we know where the issues lie. What we need now is the fortitude to make the decisions to serve those who have been underserved historically as well as in more recent times. They're not hiding, they're very visible in the data. We know we need to make the decision. Next, equitable funding allocation. So ensure that funding is allocated equitably. And what I mean by that, building on the earlier point, is prioritizing local governments with less capacity to ensure that they receive the necessary resources to implement safety and equity initiatives. So what we should do is establish a criteria that account for the needs and vulnerabilities of these underserved communities when distributing funds. I've seen it all over the country, even here in New Jersey. Those with capacity, those with resources get the funding. Those without get overlooked. And it happens systemically over and over and over again. I think we have an obligation to assist these local governments so that the process could be truly competitive. This takes us to action number 4. We have to develop programs to build the capacity of these smaller local governments. This could include the training, technical assistance, and resources to effectively help them plan and implement transportation safety and equity projects. But we have to ensure, ultimately that these programs are accessible and tailored to the specific needs of these different local governments, which takes us to action number 5. We must improve public transit and active transportation infrastructure. So we talked about the transportation underserved communities. Yes, it is true. They currently have better access by way of proximity to essential services like transit, bike lanes, and sidewalks, and as well as essential services, excuse me. But what we must do then is enhance and continue to expand these connections. And we could do so by prioritizing safe and accessible routes to transit stops and ensure that bike lanes and sidewalks are well maintained and connected. In the Orlando region, fortunately, we don't have the issues of maintaining sidewalks while it snows, but we do know in many of these low-income communities, the sidewalks are not being maintained, the bike lanes, et cetera, aren't being maintained to the degree that they should be. Which takes us to number 7, education and awareness. We must engage with the transportation underserved communities, their residents, in the decision-making processes to ensure that their voices are heard and their needs are met. So we can do this through conducting community workshops and surveys to gather input on where safety improvements are most needed. And what this participatory approach does is foster transparency and trust, emphasizing trust between the community and the organizations, which takes us to action number 7. We must strengthen our education and awareness campaigns. Many of them are sort of a one-size-fits-all approach. What we have to do is develop culturally relevant and accessible education and awareness campaigns that promote safe road use behaviors among all road users, not just those walking or cycling, but also drivers. And this ensures respectful and effective communication that considers that diverse backgrounds of community members, knowing full well how diverse the Metro Orlando region is. Which takes us to number 8, enforcement. I am not anti-enforcement. I am anti-discriminatory enforcement. So what we should do is ensure that safety resources and interventions are distributed equitably. We need enforcement. This could happen by way of automated enforcement mechanisms like speed cameras, but it should be implemented in a manner that does not disproportionately impact TUC residents. And so many may say, well, that's where our high injury networks are, but that's not where all your speeding happens. Speeding happens all across the entire region. And so when we look at the fines and penalties that result from this in working with our law enforcement agencies, we should ensure that they be structured to avoid exacerbating economic hardships for vulnerable populations. And for those wondering, well, how can the MPO play a role in this? I think you can be a convener of this conversation, which sets up a framework for ensuring an equitable distribution of automated traffic enforcement mechanisms. I think the DOTs, the MPOs, and others should be leading this in a way that ensures the community voice is prioritized. Which takes us to action number 9, enhancing data collection on crash incidents, including near misses, and disaggregating by race, income, and other demographic factors. And as we look at race, we look at income, we have to be a little more, I would say, advanced in our data analysis. We can't simply group people just by race. We have to look at this population or subpopulation within these racial groups, as there are cultural differences. And these cultural differences are your keys to engaging them in an outreach process that is truly inclusive and successful to a degree. Which takes us to action number 10, equity audits and accountability. It's imperative that we conduct regular equity audits to assess the impact of transportation policies and projects on different communities. So we have to establish these accountability mechanisms to ensure that equity commitments are met, including public reporting and performance tracking. This must be a transparent process. Action number 11, we must foster interagency collaboration. See, this Vision Zero effort isn't just one for the MPO. It isn't just one for the local governments. We need everyone involved. We need government agencies, nonprofit, and community organizations that have relationships with many of the groups discussed here to address these broader social determinants of health that contribute ultimately to transportation inequities. And this include improving housing, education, land use, and economic opportunities in these communities. But we must continue when we do that to monitor and evaluate our progress. So we must establish clear metrics and regularly evaluate the effectiveness of our implemented strategies. So it's not just enough to push forth a Vision Zero effort. If we are not measuring it over time, we're doing ourselves and the communities a disservice. Which takes us to action number 12, acknowledging the role of leadership. We must recognize that visionary, bold, and brave leadership is essential for setting ambitious goals and driving the cultural and structural changes necessary for achieving Vision Zero. I stated in the graph about moving upstream that most of this is a result of the social inequities and the institutional inequities, creating environments that lead to disproportionate impacts among people of color and low-income people of color. And if that statement is true, we can go back to the leadership to bring about the change. So we need that competent, that brave and bold leadership to make this happen. And I know this can happen because I've been fortunately through direct efforts and indirect efforts to work in a place like Hoboken, which many people will tell you, a few decades ago was not a place that many people were looking to move to, but is now one of the most desired places, I would say, in America. And more importantly, is one of the safest places in America for pedestrian, bicyclists, and motor users. The same could be said for Jersey City, where I was fortunate to work on their bicycle master plan, as well as their Vision Zero action plan. I'm not taking credit for any of the work done there. What I want to emphasize is the importance of hiring the right people, promoting the right people, visionary leadership, and mostly the fortitude to just go against opposition that doesn't center the rights of all people. That is the only way we create a transportation system for all. But in doing so, I want to caution you. See, when you make all these beautiful changes, you must do so understanding that if you don't evaluate and mitigate the unintended consequences of these improved mobility and access, what will happen is what we say in Black barbershops across America, which is trees planted in minority communities will mature just in time for gentrification to take place. You've seen many examples of that across Metro Orlando. Hopefully, we begin to undo those injustices. Thank you for your time. My name is Charles Brown. I absolutely love and adore each and every one of you and look forward to our conversations. Thank you, Orlando. Metro.
Thank you, Charles. Thank you for your insight. And that gives us plenty to think about. And I know there are some questions that are coming in. And I want to encourage folks. I understand from staff that some folks are raising their hands to ask questions. We were hoping to get you to submit those in the chat. That would save us a bit of time. So if you have not already typed those questions in, please do so during this Q&A session. We'll work through as many of those questions as we can up until 11 o'clock. Now I want to ask three members of our MetroPlan Orlando staff who are really involved in our Vision Zero efforts to be part of our Q&A session in case we have questions that deal specifically with local issues. So let me introduce Laura Bauk, Adriana Rodriguez, and Mike Wilson. Charles, I have a couple of questions just to kick it off before we go to the audience questions. And you know, I had heard so much positive about Hoboken. In fact, I do recall in some instances referring to Hoboken when I've gone out into the community and talk about Vision Zero. You know, saying, you know, if Hoboken can do it, so can Orlando. But can you take just a short time to say what, you know, I've heard that it just had such broad community support. But I also understand they're still on their kind of winning streak of no fatalities and serious injuries. Can you talk a little bit more about that?
Yes, with the disclaimer that I'm not a PR agent for Hoboken, right? So if I get anything wrong, it's not intentional. So what I know about Hoboken, Gary, which is a great question, their journey started a while ago. They were willing to be bold and brave as it relates to narrowing their streets, daylighting their intersections, and being advocates of safe transportation for all. And I forget the mayor at the time. It was a lady. She spearheaded that. But what they've done too is that they've hired some tremendous people who are whose knowledge is not just local but also international regarding Vision Zero, complete streets, and safe streets for all. And what they've done is given them the autonomy to make decisions towards that goal of Vision Zero. And of course, they are reaping the benefits of having done so. So they are a team, a brilliant team that really wanted to change how everyone viewed Hoboken, how everyone perceived safety in Hoboken. And when you have the leadership behind a competent staff in the way that they have, you can get the results that they've gotten. So that's what they've done. They prioritize complete streets.
Well, that's great news. Now I want to go to a couple of audience questions. How can local government staffs best communicate the need for transportation equity to elected leaders throughout the region?
Oh, just I think it's important for them to look to peer cities, look to their peers as well across the country who have successfully advocated transportation equity to elected officials and see what strategies, tools, and lessons learned they have, and then use that as their playbook.
Okay. Another question, thanking you for your work, Charles, and they state that your podcast is great.
Oh, thank you.
They have two questions. I may limit it to the first one. It says, around the country and specifically here in Florida, you are seeing a lot of anti-equity movements. Has this affected Vision Zero efforts at all?
Yes, it does. But more importantly, it negatively impacts our goal in the region for transportation for all. And a lot of it is rooted in ignorance. It has been politicized and is rooted in misunderstanding regarding who equity is for and what it's intended to do. So many people think that equity is simply only for Black, brown, and low-income people. But when you look at the definition of equity, it is truly about ensuring that we do right by all people. It just so happens when we look at the transportation underserved communities throughout the region, many of them happen to be Black and brown communities. So if the context was different, the conversation would be different, but the context isn't different. Thus, equity has been politicized the way it has. And I think that is grounded and a lot of misinformation and disinformation.
Okay, thank you, Charles. Um, Here's one that came in from the audience, but I kind of had the same thought. You mentioned the use of automated speed enforcement. That's been talked about some in different circles as a strategy for reducing crashes and injuries and controlling speeding behavior. The DOT often talks about kind of the next step in transportation is a behavioral thing, and to deal with that. What other technological strategies do you support to address issues and past harms in TUCs?
Oh, that's a great question. I do embrace the cameras so long as they are done equitably. Um, I think daylighting of intersections, not a technology, but a practice that has proven true could work. I think enhanced LED lighting for daytime and nighttime travel is important. Um, and those are the three things that come to mind right away.
Okay. What steps can be taken to keep gentrification from happening in those areas where improvements are implemented?
Well, it depends on what stage of gentrification one is in. So there are usually three stages of gentrification. There's the before phase, the mid stage, and then the late stage. Depending on where you are in the region, if you're in the before stage, you should advocate for more coalition building, community land trusts, inclusionary zoning, as well as rights to purchase. If you find yourself mid-stage gentrification, you want to strengthen your rental protections, look at tax abatement policies, as well as protections against condominium conversions. If you're in late stage, like many of us are in New Jersey in some parts, you want to look at employer assisted housing, affordable housing trust funds, and addressing NIMBYism.
Okay. Where's the best place to start to try and correct all of these transportation inequities?
The best place to start is with self, um, gaining a better understanding of why we are discussing equity within this context at this time and at this place. From there, move to your household, have that discussion among the people of whom you enjoy dinner with every night, and then take it to your workplace, have it with your peers, advocate for it there. And if that's not enough, join your local planning board as I've done, and then be a voice to be reckoned with as it relates to increasing access for everyone.
And who needs to be involved in these discussions?
Everyone. No
Everyone.
one is exempt from these discussions. We all bear the brunt of people dying disproportionately on our roadways. And if you love thy neighbor as thyself as I do, you want to be part of this discussion because it impacts you either directly or indirectly.
We have a couple of questions that came in from the audience that I'm not sure are directed toward you, Charles, and maybe not even to any of our staff members, but talking about, was there ever an attempt to work in partnership with the parks locally, Disney, SeaWorld, Universal, to increase public transportation to and from their facilities to help tourists and residents alike?
Oh, that's a beautiful question. I love that. I haven't done that personally, but I would love to see that happen. That interagency collaboration that I alluded to is so important. Disney, if you're listening, other theme parks, if you're listening, we can't achieve Vision Zero without you. So please come to the table and be a part of our progress.
Yeah, well, I will just add from our perspective, we did back in the federal bill that created major investment studies. We were involved in a major investment study looking at a BRT system from the airport to the attractions area, and it was a good study. And unfortunately, it kind of got tabled at our board because at the same time that a locally preferred alternative was developed, the private sector came along and enticed the region with a privately funded system. And that's continued to this day, but currently it's known as the Sunshine Corridor, and so the parks are involved. The parks are involved in that. And then we have a question about Sunrail. and its impact. It could be an important way to increase equity for people who need transit. They ask, when will we see it go farther into DeLand and more frequently, including weekends? And again, I think that's an audience question.
Yes.
And I'm not sure.
I'll touch on that. I would like to see that happen too. I would like to see more, I would say, build out of these regional systems in the state of Florida. I think they serve a tremendous purpose for everyone, not just low-income people. But we must be reminded that people have to get to those systems. And unfortunately, the route to many of those systems can be unsafe for a lot of the populations. So let's make the local investments to ensure that whether one is walking, biking, or driving to a nearby destination, that they can do so safely.
Yes.
And if I'd like to add something on that.
Sure, Mike.
I think Sunrail is actually a huge opportunity in that we could be providing assistance for developers, for instance, to provide more affordable housing near Sunrail stations, because that would then increase the ridership as well as improving mobility for those who have that disadvantage.
Yeah,
I agree with Mike.
as far as the service to DeLand Station, we don't have a date on that, but we're hearing summer of 24 for service to start. The sooner the better. And we're anxious to have that happen. And as far as frequencies and weekends, I think that the region will see that happen with the Sunshine, in combination kind of with the Sunshine Corridor and service. Once we service the airport, it's going to have to happen that way. We're pushing the envelope on time here, but Charles, I had a couple of questions based on information in your slides that intrigued me. And the first one is the slide that you talked about looking upstream. And you talk specifically about public health and the impact that has, and you may know this from your preparation for today, but we made a conscious effort a number of years ago now to include public health in our decision making, and it was a great thing to do. It was very positive for us to do that. But do you know of other MPOs or local governments around the country that are intent on make intentional decisions based using public health as kind of a criteria? And do you have any examples then of folks that are really doing a great job at that?
Yes. First of all, there's a growing group at the Transportation Research Board, TRB. Conversations are being had at the intersection of transportation and health. In that, you have people from around the world who are trying to continue to advance that discussion among those parties. More specifically, I work with the Virginia Department of Health and the Virginia Department of Transportation. They have a group, an acronym called PATH, Prioritizing Active Transportation Through Health and Safety. And within that is a program called the Virginia Walkability Action Institute. And that's where you bring together these multi-sectorial teams of transportation, health, and environmental professionals to advance mobility in the state of Virginia. Also, the Colorado Department of Transportation and Colorado Department of Health, working with them as well. And my work with them is funded by the Centers for Disease Control and Prevention. So they're providing technical assistance resources to bring these groups to the table to advocate for a more safe, equitable, and inclusive system. So those are two examples, East Coast and West, of this work happening. And I think if they can do it, Orlando can too, right, Gary?
That's right. That's right. Well, I think we're at our limit on time, and I don't want to shortchange Virginia. So thank you, audience, for your questions. And we urge you all to keep up with what we're doing at Vision Zero Central Florida. Our hub site, visionzerocfl.gov, has a lot of information and data about safety in our region. So at this time, we'll end